Hi, and welcome to Open Enrollment 2023. You know, we like a good theme here, and my partner in crime, Jessica Bucci, is a very, very good sport. And so let's get started into everything that we have to share for you this year. Okay, some important dates. You will hear me say this about 30 times throughout this presentation. And that is because we take our deadlines very seriously for open enrollment. So it will close promptly in Workday on Friday, November 4th at exactly 4 o'clock p.m. Workday is set up to close exactly on that time and date. So we're not lying about that. The last day to screen and finish logging your Health Check 360 points is Friday, November 18th. So if you did not get a chance to screen on campus, that is okay. You can go to a LabCorp. You will need to schedule that through your Health Check 360 portal, and you have until November 18th to complete that. If you need any help logging those points, please reach out to Jessica or me, and we will help you get those additional points that you need to meet or maintain that wellness goal for 2023. I promise it's easy. About as much time as it takes for someone to call me and tell me that they don't have time to do that is about the amount of time that it takes to do it. So I'm not lying about that either. In case you haven't heard, we are thrilled to announce that there will be a 0% increase in medical insurance premiums for the third year in a row. This is actually a very big deal. Most institutions, companies, organizations, while they may be able to not have an increase in premiums, they usually make changes to their other benefits. So that comes in the form of higher premiums, not premiums, higher out of pocket costs, like deductibles, things like that. So keep that in mind as we go into our third year of no increase in premiums. We are very, very proud of that. A couple highlights that we'll go over. There's no benefit changes, no contribution increases. We'll continue to offer the RX and Go and the Real Appeal and Optimize advocacy programs. Optimize was formerly Direct Path. And if you've been with us a really long time, you'll remember them as Patient Care Advocacy. So they have rebranded for the third time since we've had them, but it is the exact same company with the same everything that you can get, just a new name. We'll continue to have Delta Dental for dental, iMed for our vision. We're really excited about the Lions Living Well collaboration with the Health Check 360. And then all of our ancillary coverage will continue through Mutual of Omaha for 2023. Again, no increases for 2023. I do like to remind all of you about the cost to Lindenwood. I do get a lot of complaints about how expensive our insurance is. I'll just remind you we're a private institution. If you're coming from a public institution, it's not an apples to apples comparison. Lindenwood does pick up a huge portion of these premiums. So if you're on the family plan, whether you're on the wellness participation rate or the non-participation rate, that is still almost an additional $12,000 a year that Lindenwood pays for your premiums. So keep that in mind. Just a little overview. The deductible for the individual is $1,000. Once you add one or more family members, it goes up to $2,000. So that's $1,000 for you, $1,000 for everybody else on the plan combined. So if you have one dependent breaks their leg, meets the deductible, then all of the family members have met that deductible for the year. There'd still be $1,000 for you. Maximum out of pocket really won't come into play unless you have some serious medical issues going on. I'm always happy to help you with that. Physician's office visits for preventive care still covered at 100%. Flu shots, any types of vaccinations, any of those things are covered at 100%. Annual wellness exams, colonoscopies, mammograms also included in those. Physician office visits are a $20 copay for your primary care, $40 for a specialist or anybody with an ologist at the end of their title. $200 for the emergency room. Of course, that's waived if you're admitted. Urgent cares are still $50, and our retails is still listed at the same. Just a little reminder, what do you need to maintain the wellness participation rate for 2023? Just doing the screening, 200 points, reaching or maintaining your personal health goal is 400 points. You can log up to 2 preventive exams at 25 points each. Community wellness, that encompasses anything from volunteering. If you made a donation for $1 to someplace, we don't care. That still counts. You're contributing to a greater good. If you participated in any of the Linden Giving activities, if you volunteered for move-ins, Dark Carnival, any of those things count. It's still a volunteer, and we love it when our employees have a Lindenwood volunteer event. Complete a wellness activity. This can be anything. So that can be any of the guides that are provided to you from the College of Science, Health, and Technology. So any of those challenges, or if you're doing something on your own. I've had people come to me and say, I bought a push lawnmower now, and I have a huge yard. Well, that counts because you're doing something to be more health conscious. We've had people say, I quit smoking, and this is what I did to quit smoking. And it's just a couple sentences. It doesn't have to be a lot, but we're really happy when our employees find their own ways to do things, and we want to reward that as well. The health survey is mandatory, but it does only take 2 minutes. And then any type of a wellness webinar, anything like that counts for points. So it is really easy to get those 750 points. But if you chat with either Jessica or me, we can help you find ways to make those count. Real Appeal, just as a reminder, this is a free personal weight loss program for you or anyone who's on the plan with you. They're virtual group sessions each week. They're about 30 minutes. You do get personalized coaching based on your goals. You can track activity and nutrition. You can get a lot of nutrition counseling, and there are literally thousands of resources available in this portal. So I encourage you to check it out. Again, it is free. You do have to be enrolled in the medical plan, but it's kind of a cool resource. And we've lost 475 pounds since 2018 when we rolled out. And I think that that's pretty impressive. As a reminder, we do offer telemedicine benefits. It is the best thing ever. If any of you have tried to just get into your regular doctor because you're not feeling well, a lot of times these are some of the what I call long COVID effects of just industry. It is very difficult to get into a doctor right now. And then your only other option is running up to an urgent care. And then there's usually a line up there. So telemedicine is awesome. You do have to register online. But once you do, you can put your pharmacy information in there, and you can use it for acute conditions like infections, colds, flu symptoms, anything like that. And if your pharmacy is already loaded in there, they can actually send a prescription to that pharmacy for you, and you don't even have to leave your house for that. So it's just a really good way to get in contact. You'll be contacted by a doctor, a licensed physician within an hour. So it beats all of those wait times. I do like to put a disclaimer in here because I get asked pretty often if they believe that your condition warrants emergency care, they will tell you to go to the emergency room. So don't fear that. Arcs and Go pharmacy benefits. I always use this plug, but just one prescription a month at $12 is $144 a year. And that equals the cost of just one rescue chihuahua, which also will get you points on your Health Check 360 under community wellness. Our members have actually saved $60,000 in 2021, and that is medications at $12 a piece. So as I like to say, we're a highly medicated bunch. Our RX and Go generic, the US-based mail order program, it's amazing. We have really nice high utilization on that. But as a reminder, we do have that. You can always look online. Jessica or I can send you some information about how to look up if your medications are included in that program. Starting in 2022, RX and Go Beyond was offered to Lindenwood employees. And there's about 150 name brand medications for managing chronic illnesses. So, just to give you a little idea, this is our actual plan data from 2022. Now, this is as of September 30th. So, it's our top 25. But everything in yellow, everything in green are things, the Humira pen and the Stellara, those will be available January 1st, 2023. Everything else, there's a lot of opportunity here. And even if you're only paying, like, if these are brand names and they're specialty and you're paying like $40 a month, well, think of how many chihuahuas you could save with that. So it's just an opportunity for you to save. These are free. They are delivered out of Canada. Canada has a lot of excess medications, so it's not like an under the table type of exchange. I don't want anybody to be worried about that. But we contract, or I should say, RX and Go contracts with some of these different companies up there, and that's how we're able to get those to you at no cost. This also helps lower the cost to the institution. And we're always saying, well, why should I care? Well, when we are spending a lot of money on things where we can find cost savings, it all adds up. That goes into our premiums. It eventually will come out of your pocket. But not only could you save this money in your pocket, but if you look at some of these, I think there's one in here. It's like some of these are $20,000 a prescription. So that's a lot of money. So this 22,000 would go down. I think my broker said about 16,000. So it does save the plan money, and it will save you money. So if you have any questions about that, please reach out. Voluntary dental benefits, there's no increase, no changes for 2023. I do just like to go over Delta Dental. You can see 3 different tiers of networks, but we do have just one plan. So there's PPO dentists, premier dentists, and non-participating. Non-participating means they just don't take insurance. You can go anywhere you want to have your fangs worked on, but if you go to a PPO dentist, you will have the greatest savings. So for instance, if you go to any type of dentist, the diagnostic and preventive services will be covered at 100%. But if you start having work done like root canals, I like to call them tiaras, major services, that cost difference between that 80 and 90% can actually be thousands of dollars. I've had a lot of dental work done, and I can tell you for sure that is a thing. We don't care where you go. The point is you have the ability to save money by going to a dentist who's in the PPO network. So just be aware of that. Voluntary vision benefits. Of course, nothing is changing here. We are looking to make some enhancements to this program next year. We're not looking to change the vendor, but maybe add some more max out of pocket savings for you. Of course, everything's the same. I understand that this flyer is extremely difficult to read on a screen, but they do put everything in fluorescent lighting, or fluorescent colors, I should say. But nothing on the vision benefits will change. Optimize advocacy program. So again, formerly Direct Path. This is a free personal advocacy service, and it's available to you or anyone in your home. They can help you with things like claims and billing assistance, provider searches, deductible assistance, and what we like to focus on is cost analysis and price comparisons. So procedure costs can vary dramatically, and your provider is actually incentivized for referrals for certain procedures. So you can see on here, I always use the example of the MRI because that is, I use my actual example on here. But the cost difference to the plan, anywhere from $300 to $8,000. Deliveries, anywhere from $5,000 to $25,000. Mammograms, colonoscopies, those are actually at no cost to you. But the plan could be anywhere from 900 to like almost 9,000, and so on. So what this is you would basically call them if you're having any one of these procedures done, and you're going to say, I would like a cost analysis and price comparison. And what they'll do is they'll send you back a list that looks exactly like this here with 3 different options. If you choose the lower costing option, which you can see here, my cost out of pocket didn't change much, but the cost of the plan changed by about $1,400. You're actually eligible for 20% of the savings between the lower costing option that you chose and the higher costing option. So you'll go get your scan. So this is mine. Mine was an MRI of the brain with and without contrast. I went to Metro Imaging. This is my actual EOB. So this is, I had to send back to the person I was working with at Direct Path. It's my proof that I had the procedure done, and then I had it done at the lower costing option. Advanced radiology is where you'll see Metro Imaging. And then about a week later, after I submitted all of that, I got this lovely email saying that I would get close to $300 back on my next paycheck. So that is how that works. They will calculate your reward. I'll never know if you called or anything like that. I get a report once a month that says, hey, Candace Terry is due $277.87. You can have a maximum of $1,000 per procedure. So it used to be $1,000 a year. They have changed this to $1,000 procedure. We're all for it if you're picking the lower costing options for things. And then, of course, when my paycheck is $3 more than usual, this is exactly what I look like. If you have any questions on how to use that, please reach out. I found that was the easiest way to share that information with employees. I'm very visual myself, so I found it a little bit more helpful to show people how to use it. Our basic life insurance, AD&D, and LTD are 100% employer paid. This won't change. I hear you. I am looking at buy-up options for 2023 to enhance those benefits for you. So as a reminder, every full-time employee receives a $50,000 life insurance policy. Please make sure you have beneficiaries listed in Workday. If something happens to you, I can't come back to you and ask you who that should go to. So I'm going to enter my name in there. That's always my threat. Accidental death and dismemberment, also $50,000. And then long-term disability. So long-term disability will pay 60% of your monthly earnings to a maximum of $10,000 per month after you've been out of work for 180 days, which is basically 6 months. So benefits are payable until you are no longer disabled or you reach Social Security retirement age. I do want to say that all of these benefits are employer paid, so they are taxable. And there are age reduction benefits at the age of 65. So please keep that in mind as well. Now, on the voluntary benefits through Mutual of Omaha or MU, those we pull from your tax post-tax, which means when you are paid out in the event that you need a payout from any of these, it's not taxed. So we do that on purpose. Typically, if you are applying for these benefits, you really need that money. So we want to make sure that you're able to get as much as possible. Supplemental life, you can purchase this in increments of $25,000 up to $100,000. There are reduction of benefits at age 65. Spouses are eligible for 50% of what you elect in the supplemental coverage. So if you want to add a spouse, you have to add additional supplemental for yourself. Children are a flat $10,000 policy, and then it's only 45 cents a month, whether you have 1 kid or 10 kids on there, it's still 45 cents a month. Evidence of insurability is required for any either increase or new election into supplemental life insurance. So you will receive an email from Mutual of Omaha copying me stating that you need to complete that, and it'll have a link for you to complete that questionnaire. Short-term disability, in the event that you are disabled from working, even temporarily, this is payable for up to 26 weeks, which is right about 6 months, and then that long-term disability would kick in. There is a 2-week waiting period for the short-term disability benefits, so you do have to be out 14 days for that to be able to start kicking in, and then it's a max of $1,000 a week. The stipulations that apply are if you have a condition that you're currently being treated for. So I give this example all the time because it happens every year. If you're currently pregnant and you're not enrolled in the short-term disability, you can enroll in the short-term disability, but it's not going to pay out for your maternity leave. And the reason that is it's seen as a pre-existing condition where you don't have to have like evidence of insurability to enroll in it. You do have to make sure that you're enrolled into that and paying into it before any of that happens. So it's really important. That's why I tell people, I'm like, make sure you plan ahead on this stuff, because you can enroll in it like when you have a baby, but it's not going to cover that period of incapacitation. So I harp on that a lot because it happens pretty often. So I figure one more time won't hurt. Voluntary benefits continued. Accident insurance provides a benefit if you or your dependents who are enrolled or injured in an accident. So sprains, broken bones, burns. If you are in an accident and you like fall off a ladder, break your leg, they will pay certain amounts towards your deductible. It's a really low cost insurance. It's tiered. It's employee only, employee plus spouse, or family, which is either which is employee, spouse, and children. Employee only and employee is included with employee children. So that's one. Whether it's just you or you and your kids, there's one for you and the spouse, and then there's a family. So it's a very low amount. Critical illness, evidence of insurability is required on this. What this does is it provides a benefit if you or your dependents are diagnosed with specific illnesses. You can be completely treatable and with a magic pill for cancer, heart and organ issues, if that exists. It doesn't matter, you're diagnosed with it. You can use that money to help supplement any lost income while you're out. Some out-of-pocket costs. Maybe you want to travel to Mayo Clinic on the East Coast, or maybe you're terminal and want to spend your last month on Bora Bora. It doesn't matter. My point is they pay it out to you. It becomes your money at that point in the event of a diagnosis. There's also what's called a wellness benefit for an annual preventive exam. So I'm going to use the example of colonoscopies and mammograms, which you should all be getting anyway. So if you're getting that, you can get points for your Health Check 360. If you go through Direct Path, even if you're already going to the lower costing option, just do it. You can get money back for that. And then if you're enrolled in one or both of these, you can actually get a $100 check for each one that you're enrolled in. So there's a lot of ways to earn that money back. Spouses and children, if you have them enrolled on these as well, you can also get a $100 check for each one of these that they're enrolled in. Flexible spending accounts. We'll continue with PNA, or who we lovingly refer to as PANDA. The maximum for 2023 is $3,050. The IRS raised that by $200 this year. It's the most I've ever seen due to inflation. However, the dependent care FSA is still $5,000, and that is per household. I do get a lot of questions on that, so I wanted to just reiterate that. If you have a spouse working somewhere else, you can figure out what might be better for you tax-wise, since this is a pre-tax benefit. So, if one of you does $2,000, the other one does $3,000, however you want to do it, it's $5,000 per household maximum. The plan year is January 1st to December 31st every year. If you've been with us for a while and you've been enrolled in this, your cards will still be good. They expire like a credit card would. They're usually good for about 5 years. If you are new, you will receive your card in late December, early January from PNA Group. So don't throw it away. It does look like junk mail, I will admit. But you have until March 15th of 2023 to spend your 2022 elections. So if you are needing help spending that, Jessica and I are really good. Well, spending money in general, but we can really help you with that. There's an awesome store called fsastore.com, and everything on there is approved. So just a couple ways to help you with that. We also want to remind you about our new EAP vendor. We're really excited about them. Support link. They have a lot of things that are available for the right now. So maybe you just want to text for some quick advice. You don't necessarily want to go through talking with somebody. It's perfectly fine. We've all been there. This is a great way to start. There is a QR code We have flyers in Workday. We're also happy to send those to you as well. They have specialized resources for teens. There's virtual support groups, which I thought was awesome. Sometimes it's nice to know you're not alone, even if you just go to like 1 or 2 sessions. It's nice to hear from other people and what they do, is what I found through talking with other employees. So please reach out to us. You can still get your normal, like if you want to see someone face to face, if you want to Skype with a counselor, you absolutely have that access. But what's great about Support Link is that there's just so many other ways to connect to support. Okay, again, and finally, I will say open enrollment closes promptly at 4 p.m. on Friday, November 4th. The last day to screen or log those health check 360 points is Friday, November 18th. So you still have plenty of time to do that. Don't wait till last minute. But Jessica and I are here to help you in any way that we can. And we also want to thank you for all of your efforts in helping us keep those premiums down so we could bring you another year, a third year in a row of no increases. And we look forward to seeing you on campus. Have a great open enrollment.